Each day of the 8th International AIDS Society Conference on HIV Pathogenesis, Treatment and Prevention in Vancouver, Canada, we'll be talking with Dr. Carl Dieffenbach from the National Institutes of Health. Here are highlights from July 20th, 2015. Hello, this is Miguel Gomez, the Director of AIDS.gov. I'm lucky to be speaking with Dr. Carl Dieffenbach from NIH. Dr. Dieffenbach is in Vancouver, Canada. He is at the International AIDS Society 2015 conference. Sir, we're going to ask you, and we're so lucky to have you providing us daily updates from the conference. Today was the first full day of the conference. It did start last night. From your perspective, could you share some highlights?
Sure. My pleasure, Miguel. So today at the conference, we had a series of really spectacular talks, so it's kind of hard to pick out two, but I will. So the first I'd like to discuss is a presentation from NIH's Dr. Anthony Fauci, where he talked about the comprehensive prevention agenda. What Dr. Fauci presented was a comprehensive vision of HIV prevention and how it can come together to help bring the epidemic under control in our generation. He talked about a couple of very important tools that we have. The first was Antiretroviral Therapy. That's the drugs that people take to control the virus and help keep them healthy. It has the additional benefit, as reported at this conference, of actually preventing HIV transmission completely. That was a study that was completed a couple of years ago, the HPTN 052 study. We now have long-term follow-up from that study, and it showed absolutely conclusively that if you take your medication and you have full control of your virus through this medication, you will not transmit to your sexual partner. The other major tool that he talked about was the use of these medications, again, as prevention for HIV uninfected people. This is referred to as pre-exposure prophylaxis. And the data coming out at this meeting and the way he highlighted it, the idea is, could we get to a point where testing, which is absolutely a critical part of what we do, testing for HIV, if you're HIV positive, you go on therapy. If you're HIV negative and you're at risk for acquisition of HIV, you could go on PrEP or other prevention strategies. Those are the tools we have today that can move forward. He also talked about the necessity of having a safe and effective HIV vaccine, and it laid out the research plan that we have to create a number of candidates that are in evaluation or moving into evaluation to see if they are effective. The combination of what we're doing, what we have today, the new tools we're building, can really help us bring this epidemic to its knees within our generation. In addition, then the other part of his talk dovetailed very nicely with Ambassador Debbie Birx's presentation today on how PEPFAR is evolving to address the new challenges of implementing expanded treatment around the globe. And Dr. Fauci touched on how we can address the implementation gap, how we can come together as the U.S. government and help our partners to really help bring down global incidence. Her message moving forward was they are in the process of re-engineering how to improve the delivery of care and treatment, how they are also expanding prevention messages.
That's great news, sir. I want to thank you for your time. Look forward to talking to you tomorrow and get more reporting from the conference. This is Miguel Gomez with AIDS.gov. For more information on the conference, please visit IAS2015.org. And for more information on federal HIV programs, please visit AIDS.gov.